I'm Lindsey Wynkoop. I'm the current education manager at the Pacific Eye Institute. As the education manager, I'm primarily in charge of the nursing program here at Fred Hollows with the Pacific Eye Institute. And we're training doctors and nurses from around the Pacific. Coming to this institution and actually seeing what Fred Hollows is all about and the tremendous support that they give on all levels, not just to fundraising, to provide for outreach and services, but to provide scholarship and opportunities for these nurses that are actually out in the remote areas and doctors from areas that they may be the only eye care provider when they go back to their home country. They really have the right idea as far as where we need to be targeting. We're now people. Getting to this stage, and we're proud of it, that we've trained many doctors and nurses now that are going back to their countries, and hopefully we'll continue to carry on that message. So that's our goal. Is one of the goals as an education person is to help pass on that message and, you know, teach one and then to teach 10 and to keep teaching. I think that is a good reminder to us of what good is being done for not just within eye care, but as a representation of health in general. A good model Fred Hollows puts out to perhaps for other organizations of actually putting institutions out there for people to train, but then to pass on those messages to their own countries and hopefully eventually work within their own communities and own nursing and doctor population to try to continue to train others on what they learned here at the as far as being a woman in this role and having a doctor background, I think it's a good role model for a lot of the nurses that are here, and still within the Pacific it is very male dominant in many fields and within community, home environment, etc. So we're seeing a lot of the nurses coming through that are both female and male. I think it's good for them to be able to work with other peers that are also female, as well as a leader from, I guess, myself, and for them to see that they can still do a lot with their careers and that they can take things to the next level. And they actually take a quality management course, and they're taught some or reintroduced, if they've been doing it, but ideas on how to actually manage their own clinic and be leaders within their own communities. So I think that having a female being their push may be something good for them, and I'm always a pusher, if you will, to the students here, and I tell them that from the beginning, that I'll take them as far as they want to go, and so sometimes they like me for that, some days not, but most of the time it turns out well. So I think I've gained a much bigger respect for the grassroots of all, not just eye care, but health in general, as far as public health awareness and actually getting wellness messages out there, getting out into the community and promoting what we actually, what problems you can have with your eyes, or that a simple medicinal, traditional herbal medicine may not be the actual remedy to their problem. So I've taken a big appreciation for training our nurses and others to get down into that community level and really get to their actual populations and give them awareness about what eye care is all about.